Really, that's the focus of this hearing, although, of course, overall, our purview is just around, one of the themes that we're trying to lift up in this whole thing are, one, coverage does not always equal care.
Right.
And there's a confusion around that, right? Like, well, if I have insurance, then everything is fine. But it's like, actually, insurance is not the same thing as care, right? Coverage is not the same thing as care. So lifting that up, and then, of course, we're gonna lift up healthcare is a human right. And then, but the stories are sort of focused either from the provider perspective or the patient perspective on how they've seen increases in the premiums, the copays, the deductibles on marketplace plans, and how that's impacted their ability to get care. Or, again, we have stories of folks who are choosing between paying rent and paying for premiums.
Because the other insurance didn't kick in and they're off the other one, or all kinds of stories about gaps in care that were really necessitated, and it was dramatic. So it wasn't like somebody made this decision over $12 a month. They made this decision over, and $12 a month could be significant, but I think the couple that came to me were, $100 a month.
Mm-hmm.
Well, that's huge. How does that plan go? And it was the same level of coverage.
Right.
And they had a plan for 2 years. The second year is when they got the huge jump.
Mm-hmm.
And then we could find them an equivalent plan that took them back. And so, they'll continue on for a year, but it was, I think another effect is it is disempowering and disengaging. So if this is the game,
Mm-hmm.
and that's what we hear, so this is the game now that's going to be played, and will I participate in this or not? And so that's a concerning theme, that when we have these kinds of rate hikes and this kind of approach.
The thing that's exciting about what we're doing is it's poor people actually can have agency. They can actually change it. Half the problem is figuring out what is going on in the first place, right? So who is making these decisions, and then taking action together.
Because that's what we see in our members overall, is kind of this shift and this transformation from, oh, this is the way it is, this is how it's always going to be,
Right.
whether that's about me personally or whether it's about the larger system, to, oh no, we can shift things, we can actually change things, and also I can change, right?
Put people first. This is what the hearing is about. We're actually bringing people who are actually affected by this to then say that there can be another way, right? We don't that's what Family First and my health center that I work at is it's not there to make as much money as possible. It's actually people are human beings, and they're not dollar signs to then make more money out of, right? And that's what I'm really excited about. And
We're doing all that prep work that I talked about, and determined, this long-term patient changed her insurance and is now participating with a provider that has really, WellSpan doesn't participate, we don't participate, I don't know who the participating providers are.
That's right.
She has an appointment today, so that activated a whole chain of let's get her on the phone, let's see what's going on, because there's the side that, that she sees, which is just, you're my doctor, and you're who I identify with.
That's right.
And then the provider perspective, which is we have contractual agreements that prohibit us from billing and seeing patients that we don't have a contract with their payer. And so that, and we're starting to see, so we've had a few of those, and we'll continue to have more as that reality sets in. And the challenge between Medicare and what we have in Medicaid, and the same thing could be said for marketplace plans, is much like employer plans, you have your once a year opportunity, you have your window, and then for 12 months. So then, both, this woman is feeling stuck, we're feeling stuck on the provider side. Mm-hmm. So do we, the core question is, do we write off care for a year?
With, if patients want to share their stories, at the hearing, we would love to, we can help coach them, we can help tape them, we can help them write letters, if they have trouble, expressing themselves,
Sure.
but they want to, and it's challenging to have staff that's not necessarily what staff is working on, but it's an issue. We totally have volunteers that will help work with them on that, and I know